So another concept that we think is going to take functional medicine forward significantly over the next 5 years is health coaching. And as part of our Future of Functional Summit in Powder Mountain, Utah, we had a panel on the future of health coaching as part of functional medicine. We included some leaders in the field of functional medicine health coaching, and also Dr. Sachin Patel, who at the Living Proof Institute is integrating coaching into his practice in a really innovative way. There were some great moments from the content, and here are some of the best bits. Enjoy.
We, as practitioners, we can only do so much. And we know that the doctor does what they do best. They can diagnose, they can treat a condition, and they didn't go to school for training in how to help people become inspired to make those crucial changes. So even if they say, we're prescribing lifestyle change, we want you to do this, they're languaging it in a way that the patient is sitting there and then they walk out and they don't know often where to start, or they're still very resistant. So what coaches do is they bridge that gap. And a coach is somebody's personal cheerleader, their personal ally, to inspire passion and purpose in others. And so I felt that that's the missing link in functional medicine, because often they are overwhelmed. They don't know where to start, or they are not overwhelmed and they start to make some changes, and then there's an obstacle, a setback, and then they pull back from it and they don't continue. So a coach is not there to replace a practitioner, to replace whether it's a physician, a dietitian. They're there to support. And so what we do is create alliances to say that they can partner with doctors, they can partner with nutritionists, and create that now somebody has their own personal ally who can support them through that journey. And what a coach does, it comes from client-centered psychotherapy. And it's going with that person, even if where that person wants to go may not be the client, may not be the coach's agenda. And so it's really, that's what makes it so powerful, that it is completely client-centered.
I think you've probably noticed, like me, at the functional medicine events, the leaders, Bob Roundtree, Jeff Bland, whatever, saying, hey, I'm glad you're learning all of this science right now, but you need a coach to implement it. And that seems to have changed in the last year, particularly.
Absolutely. And coaches are trained in functional medicine now speak the same language, and there's more and more doctors. We're seeing every year more and more people coming to us saying, help me get a coach. How can I find a coach? So there's a big movement to understand what coaching is, as well as to go ahead and get a coach.
Thank you. Tracy, I just wanted to follow up from that. If someone has coaching skills, or they have some sort of skills in that regard, what is it about the functional medicine operating system that sort of up levels their ability to be able to help people?
I think one of the most important things is credibility and skill set, because there are a lot of coaches who want to practice in a very basic, foundational type of way, sort of life coaching, if you will, and very similar skill sets there, to Sandy's point, in terms of rapport and accountability and inspiration. But the science of functional medicine, I think, adds a tremendous component of in the educational realm. Because when a patient is not feeling well, they will often exhibit compliance because they're afraid, because they're desperate. But it becomes very challenging for them to sustain that wellness without the right type of support. And I really believe that's one of the biggest benefits of this magical combination of functional medicine and coaching. Because if we can explain to someone with language they can understand, with simple analogies they can relate to, what's actually happening in their gut, and why certain behaviors drive that dynamic, and why certain positive lifestyle choices will prevent it, you can watch them come alive with knowledge. And I think that's why education is so huge for coaching, because people will do what you tell them to do as long as there's a negative motivation, right? I want to feel better. I'm sick and tired of being sick and tired. But once they have the knowledge, then they want to tell everyone they know. And they go to family reunions and their work colleagues and their best friends. And I told them, do you know why you have IBS? Let me tell you why. And I drew a picture and I told her, don't listen to those blogs online. You have to get real science. well, then that person is on fire. And they become a community to the people they know, so that health and wellness, again, becomes a community movement. So I really think coaching is a linchpin for creating this sort of cascade effect. They told two friends and they told two friends, based on real solid science versus a whole bunch of myths and what people manage to find online.
Awesome. Andrea, you've been doing this in your practice. I'll give you this mic if you want this. You've been obviously doing this with Replenish and now, Functional Nutrition Alliance. As you've trained these thousands of people, how do you feel that sort of like is the best order of you're very into order, right? So what's the emerging order for these providers to work together in this team?
Yeah, I should say that in addition to being a quick start, I'm an implementer, which means I like to break things down. So one thing I want to say is that I loved that Christy Hughes several years ago at the Integrative Health Symposium stood up and asked every type of practitioner to stand up by their title. And then she said, who here is a health coach? And asked everybody in the room to stand up. And Sachin is really demonstrates this throughout his clinic and what you subscribe to, and that all of us are coaches in some way or another. And we all need to be to understand the functional medicine model. So I really like to look at the gap in the functional medicine model, because in order for the operating system to function, every type of practitioner needs to know and have a system in which we work. We need to understand the science, the operating system within, like Tracy is talking about, and we need to understand the systems with which we approach things. So functional medicine doctors are still often working at what I call tier 3, the third, the infection model. And we need to understand through the nurses, the physician's assistants, how to work at what I call tier 1 and tier 2. What are the non-negotiables that allow somebody to heal? And what are the deficiencies that really we can understand through a scientific perspective to get into a person's ability to heal and to subscribe to those infection protocols? So I like to call it a 3-tiered system, and I think we need to understand that at every level. I really feel that the allied functional medicine practitioner is what becomes primary care, because the doctors are too overwhelmed with all of the everything that they're being asked to do in the functional medicine model, and that they're not necessarily trained, like Sandra was saying, to deal with different aspects of modification, behavior modification, and deficiencies, and understanding how to remedy them. So I think it's really up to us to wake up the other practitioners. I love training the nurses and the physician's assistants and the dietitians to get in there and work in partnership. So that's how we're going to really make this change. And I think all of us here are about the partnerships we can create to make the functional medicine model work.
Awesome. Thank you, Andrea. And Sachin, maybe I can just come to you, because like last year, one of the most, I do, basically the way that I sort of seek to learn what's going on in the industry is I'm just interviewing people. We've done 3 summits, that's 90 interviews, 150 podcasts. And Sachin, we did an interview where you sort of described the order in which people sort of have to earn their way through the clinic. And I'd love for you to just share that, because I just feel that that's something that you have locked down, that organizes the providers in what seems to me like the optimal order.
Sure. So first of all, I think that what we have to realize as practitioners is the value of our care is actually $0 if our patients don't take action. So we could charge them whatever we want, but if that person leaves and doesn't do anything, then it's a complete waste of their time, our time, and unfortunately their money. And I think that all of us want our clients to see results. Each and every one of us wants our people to get better, because that's what we do this. We don't do it for the Ferrari. We don't do it for the Lambos, right? Like, I don't think anyone's here to do it for that reason. So we do it because we want to see our communities heal and get better. So I think the thing with us that makes our practice really unique is and I'm sure many of you are applying this, is you have to be very selective with who comes into your fold. You have to have somebody, a patient, who's coachable. Because if somebody's uncoachable, it doesn't matter how good you are as a coach. It doesn't matter how well you lead them if they're not somebody that can be coached. So filtering that person is very critical. Our time is extremely valuable. Who we spend that time with is extremely important. And the value that we generate through this process can be infinite if that person takes action. And as Tracy was saying, if that person takes action, gets results, and then starts sharing with other people, the value that we're able to deliver is essentially infinite into our communities. So the way we process patients before they come to us is our primary objective is to teach people how to stay out of our office. So we do that through, we have an online Facebook community, we do that through the education that we share online, because I believe that about 80% of people, it's like the Pareto principle, 80% of people actually don't need our care, they just need to care for themselves. And that eliminates most of the people if they can care for themselves and their families, and it's really about self-love. But there's about 20% of people who do have stealth infections, stealth deficiencies, need a coach, need somebody to find their objective blind spots, and that's where we come in. So it starts by showing people you love them enough to keep them out of your office. And then with the people that do come in, you want to make sure they're coachable, you want to make sure that they're going to apply the concepts and things that you're teaching them. And then you have to provide them with the right people in your space, or refer them out if you need to, in order for them to get the results that they're looking for. So when they come to see us, they see a practitioner first. Their second appointment is what we call the anti-supplement appointment, because we don't want to supplement lifestyles, right? I don't want to give somebody an energy supplement if they're not sleeping well, right? I can't out-supplement bad relationships. I can't out-supplement no time in nature and sitting at your desk. So we have to really get them to understand that we're looking out for their best interests. We're going to give them supplements for the true deficiencies that they have or the toxicities that they have, but we're not going to make this, walk out of here with a bag full of stuff, because you're not changing your lifestyle. And so coaching is such a critical point. And so our coaches, our patients have access to our coaches through email. We have our Facebook community where people can post questions, and that allows us to scale time. So when you do things in community, you can actually scale time. People talk about time management in their practice, but I'm not interested in managing a finite amount of time. I'm interested in scaling time. So if I can do something, if I can share a 5-minute video and 1,000 people see it, I just did 5,000 minutes of work. So I've scaled my time significantly. And so online groups and communities are an excellent way to do that. If you're not doing that, then I encourage that you leverage that as best you can. And then we have a variety of practitioners that work with us. We have high performance coaches, we have hypnotherapists, because a lot of people deal with subconscious problems, and we can't consciously fix a problem at a subconscious level. It's kind of like using whiteout on your computer screen, right? As soon as you scroll down, the problem's still there. So a lot of times we have to work with people on that level, because that's where their behaviors and patterns and things like that come from. So we work in different layers with our patients. So consciously, subconsciously, nutritiously, environmentally. We just did a workshop the other day. There's a 300-year-old oak tree in our community, and it's the oldest tree in Mississauga where I live, and we did a community workshop underneath that tree. And the guardian of the tree, who takes a picture of it every day at sunrise, was there serendipitously. She was there, and she got to share the story of the tree. So pretty profound things start happening when you start engaging in your community and in nature, and giving people these opportunities to connect with you.
As you see, Sachin could definitely have been in part of the community discussion yesterday, because Sachin's using this combination of community and coaching, which we're talking about all weekend. Sachin's really been innovating, and I can see it happening because it's all happening on social media, and I feel like I'm right there. Maybe I throw this back out to Sandy here, is that I think in the IFM survey, there's an understanding, more and more doctors are understanding that they need a coach, but it's not quite getting to a point. A lot of them are still delivering that service themselves. And I'd just love to get into a little bit here with you, is like, what is the value of that team? And why shouldn't doctors be taking on that coaching role?
Sure. So first of all, I agree with Andrea that we're all coaches, and learning some simple changes in how you phrase something, how you ask a question, how you give advice versus asking somebody for their meaning and purpose, and they discover it themselves. So that's very crucial. And doctors often have a hard time understanding. I had a conversation with someone in my community. They're setting up some functional medicine clinics in the area, and so they were going to have the doctor, the dietitian, and she was asking, well, what's the difference between a coach and a dietitian? Which direction should I go? What do coaches really do? And so, first of all, coaches really support that physician and make their lives easier. So there's been some studies that have come out in the past year that have looked at primary care practices. These were family doctors, and they looked at those who had coaches versus those who didn't. Now, these were not functional medicine practices. The coaches were not using the model of functional medicine coaching, but the doctors were describing just having a coach that they could now have their patients with chronic conditions, those who were contacting the doctors at all hours that were the complainers, difficult to manage. And they said now their lives are easier. And so on measures of stress, they were saying their lives were less stressed. And then they measured the patient on biomarkers like hemoglobin A1C, and those who had a coach to support them had lower levels. They also reported better quality of life. We are also doing our own outcome research. We have our students do an apprenticeship, and we have, they see clients virtually, and we have those clients fill out some measures. They do the promise, they do the medical symptoms questionnaire from IFM, a couple other measures, and then we measure them again, and when they're through with their coaching with an apprentice, and the pilot results that we've gotten so far are very promising, where they're showing that, especially on quality of life and measures of well-being, just with a few, we're talking 5 sessions with a coach, and they're showing good results. So I think that doctors can and doctors do respect research. So we have those studies and say, okay, this is a result, what happened when these practices worked with a coach. So it's the whole office benefits, and physicians were able to go home earlier. They were able to, again, carve out, because their time now was spent doing what they loved to do, what they were trained to do, as opposed to working with some of these very difficult chronic conditions.
Absolutely.